Good day everyone, I'm Carl Breda, and today I will be demonstrating to you a procedure about starting an intravenous infusion. First is you're going to compare the physician's order and the medication ticket. Then make sure that you wash your hands before performing the procedure. Then gather all equipments. We also need to maintain a aseptic technique when opening sterile packages. First is we're going to open our IV solution by pulling the cup. Then we're going to open our macro set. Make sure that we check for the expiration date and check for any holes. We also need to maintain the sterility of the tips of the macro set. After that, we're going to uncap the spike and insert it into the entry side or the guided hole of the bottle of our IV solution. Again, we need to maintain the sterility of our spike. Then we're going to raise the IV solution or suspend it on a hook and press the drip chamber and allow it to fill at least halfway. So suction effects causes fluid to move into the drip chamber and also prevents air from moving down the tubing. Now we'll place our IV solution into our IV pole. After that is remove the cup at the end of the tubing, then release the clamp and we allow the fluid to move through the tubing. So this is termed as priming the tubing. And also to allow the fluid to flow until the air bubbles have disappeared, and we make use of our kidney basin. Then we recap the end of the tubing, maintaining the sterility of the setup. Now we're going to inform the physician or the nurse who will insert the IV. And then we bring the preparation at the bedside of the patient, then we explain the procedures. Make sure that you already prepared your plasters that will be used in inserting your IV cannula beforehand.
Ma'am, magbutang kong tourniquet, ma'am, ha?
Now with the use of cotton ball with alcohol, disinfect the area. Then remove the needle from its wrapper and also remove the cup from the needle. So once the cannula is already inserted, you'll just have to anticipate for the backflow. And when there's backflow, you're going to put your first plaster. And then you can now remove your tourniquet. Secure the cannula with your plasters, and then you can now remove the needle from the cannula. Then insert the IV line into the cannula. Then you secure it with your plaster. Loop the tubing near the side of the entry and anchor it with plaster to prevent pulling off the needle. So after you secure the IV, adjust the rate of flow according to doctor's order. You're going to regulate the IV according to the drops per minute that you have calculated earlier. And then after calculating it, you have to put it here on the IV label where you're going to put the name of the patient, also the type of IV. You also have here the time started and the due time. After that is you're going to place that on your IV solution. And then when you're about to regulate, make sure that you place your wristwatch near the macro set. So you're going to match the drops per minute to your watch. Make sure that you're going to do aftercare and then wash your hands to deter the spread of microorganisms. So that's it.
Good morning everyone, I am Thea Marie M. Cainya and I'm going to demonstrate on how to discontinue an intravenous infusion. So when the patient no longer needs IV fluids, IV medications or access for emergency drugs, the cannula is removed. Standard precautions must be followed when removing an IV cannula because there is almost always a slight amount of bleeding that occurs. The equipments that are needed are the working gloves, the plaster, the waste receptacle, and the gauze bag. So check the physician's order for discontinuing IVF. Perform hand hygiene to deter the spread of the microorganisms and to don gloves. Identify the patient and explain the procedure. So first is to remove all the tape from the IV and tear each side while stabilizing the IV and removing the surrounding tape. After removing the surrounding tape, take the gauze and put it over here in the upper part because I will be sliding this cannula out. Take everything and grab. Pull the cannula in one smooth motion and inspect cannula to make sure that everything is intact. And dispose this in the receptacle area. Hold firm pressure about 2 to 3 minutes. After applying pressure, check the site and make sure that there is no bleeding anymore. After ensuring that there is no bleeding, take the plaster and tape over the gauze. Discard used supplies appropriately. Remove gloves and wash hands. So in the documentation, record the amount of fluid infused on the I&O record sheet and on the chart if necessary. Include the type of solution used, time, and reason for discontinuing the infusion and the patient's response. That's all for today. Thank you and God bless.
Blood transfusion. Definition. A blood transfusion is an introduction of whole blood or components of blood such as plasma, serum, erythrocytes, or platelets into the venous circulation. The purpose of blood transfusion. First, to restore or increase circulating blood volume after surgery, trauma, and childbirth. Second, to restore or increase the red blood cell level after severe and chronic anemias and to maintain blood hemoglobin levels such as in leukemia. Third, to provide selected cellular components as replacement therapy such as clotting factors, platelets, and albumin. Before beginning this procedure, always perform the following steps to ensure patient safety. Perform hand hygiene. Provide patients privacy. Introduce yourself. Identify the patient. Verify allergy status. Perform environmental safety check. Ensure proper body mechanics. Gather all the supplies. Provide patients education. Verify MD order. Assess for the procedure needed. Explain procedure. Educate the patient about the rationale of the procedure and associated adverse reactions. Materials needed for blood transfusion. Biohazard bag. Alcohol pads or cotton balls with alcohol. Blood tubing. Blood product. 500 cc bag of NS or normal saline, 10 ml of normal saline flush. Assemble supplies before entering patient's room. Complete pre-transfusion steps prior to blood transfusion infusion. The nurse must verify the blood before the start of the procedure. Verify blood bond with blood unit. The procedure. Assure patency of IV line. Hang normal saline flush bag. Spike normal saline bag and prime tubing, filling blood tubing filter completely. Caution: close normal saline roller clamp before continuing to the next step. Spike blood bag. Open blood roller clamp and prime tubing. Be sure to prime the entire line. Connect IV tubing to the patient's IV access. Set pump to deliver blood at no more than 2 milliliters per minute for 15 minutes. Monitor patient for adverse reactions. Measures vital signs after 15 minutes to ensure patient is tolerating blood transfusion. Increase infusion rate after 15 minutes per MD order or facilities policy. Measures vital signs when infusion is complete. Disconnect blood tubing. Flush IV line. Note patient response to transfusion. Discard tubing and blood bag. Dispose of soiled supplies. Ensure safe environment. Return bed to lowest height with brakes lock and appropriate side rails up and call light bell in reach. Lastly, wash hands to deter the spread of microorganisms.